We're now with the Health Department, and I note that Councilman Stein was with us at the earlier hearing at the Hospital Authority and is here for the Health Department. And Dr. Paul, if you could introduce yourself, your colleagues, and then make whatever statement you have regarding your budget.
Okay, thank you, Mayor. Good afternoon, Mayor Dean, Mr. Hinote, Mr. Riebling. With me are, at the table, Stan Romine, Director of Finance and Administration, and Diane Harden, our Finance Manager. We also have Bill Hance here, who is the Chairman of the Board of Health, over my left shoulder. Mayor Dean, I want to start by thanking you for your leadership and your support of active living in Nashville, both the walks, the runs, whatever the other efforts, also the efforts to improve Nashville's environment in ways that make it easier to live a healthy and active life. Between open spaces, parks, greenways, bridges, Nashville's environment is surely healthier than it was 5 years ago. In the Health Department, our mission is to protect and improve health, and the scope of our responsibility is very broad. There are many different things we need to do to accomplish our mission. We need to do all of them well. I want to thank the dedicated and skilled staff of the Health Department who are out there every day working all across the community to ensure conditions where people can live a healthy and safe life. This week is National Public Health Week. So the national focus this week is on return on investment in public health, on the many ways that public health delivers value, saves money, and saves lives. Locally this week, the poured foundation for the new public health headquarters on Charlotte is complete, and steel girders will start going up either this week or next. Also, as you know, this week the Healthy Nashville Leadership Council will kick off a community assessment and planning process, and this will help shape and mobilize public health efforts for the coming years. Nashville's Community Health Improvement Plan will dovetail with the new general plan, Nashville Next, and capturing community priorities for health and well-being, and also help mobilize action for a healthier Nashville. So we are moving forward, and we appreciate your support. I want to mention a couple of specific accomplishments in the last year. We played a major and life-saving role in the outbreak of fungal meningitis. While the state took the lead on the investigation, we contacted hundreds of patients to notify them of their exposure, give them information, and follow up on them. Also, 2 weeks ago, we successfully implemented the first ever full-scale drug dispensing exercise at 2 high schools at the same time. We also, in the last year, of course, rolled out B-Cycle, the bike share program, and completed the objectives of the Communities Putting Prevention to Work grant. Also, the New Life Fatherhood program continues to equip dads in North and East Nashville to become more engaged in the lives of their children. This year we had 20 employees take advantage of the buyout with over 540 years of experience, and we're doing the stretching that we need to do to ensure that our core services are maintained. Regarding the Board of Health's budget submission, I thought it might be good to just touch on a couple of points for the viewing audience. We still do oversee the 2 major contracts, jail health care and forensic medical examiner. The total for those 2 now is $16 million. We monitor these contracts within the department, but the contract amounts are in a separate place and not in our operating budget. Excluding these big contracts, our operating budget is about $45 million. The locally funded portion is about $19 million. And within the local budget, there are several programs that are partially or fully supported by fees. So local taxes, property and sales tax fund about $16 million, or just over 1/3 of our operating budget. The local investment in health protection has been reduced by about 25% in the last 5 years. With regard to the 2% budget reduction scenario, our submission meets this target by eliminating 2 positions, rehiring several buyout positions at lower salary, and reorganizing some work. Specifically, the 2 positions eliminated are ones in facilities management and the others in air pollution control. In pollution control, we've had a decline in the number of large major pollution sources, which are called Title V sources, and this will enable us to make do with 1 fewer staff member. We are submitting 4 budget improvements, and we hope that you'll consider these. We believe they're important for us in the coming year. The first 2 are in keeping with instructions from Mr. Riebling to look for revenue when preparing our budget submission. The first improvement is for 3 additional field staff positions in animal control. This really brings us back to 2007 levels, which is the number of positions we had before the economic crisis. We're proposing to cover the cost of these positions with an increase in the pet licensing fee from the current $4 to $6. This fee has not been increased since 1989. We project this will raise about $150,000 in revenue, which will cover the cost of the positions. The second improvement is 1 position. It's a public health planner and grant writer. Now, over half of our budget is grant funded. Health reform, other drivers in the world of community health really have brought many competitive grant opportunities, and we believe that those will continue. So health departments especially, and also communities can have an increasing number of competitive grant opportunities. We think grants represent some of our best opportunities for new efforts to impact health in Nashville. We did have some big wins, communities putting prevention to work and the Fatherhood Initiative. But we looked back at the last 2 years, we found nearly $8 million in grant applications that we started or prepared that were unfunded in 2 years. This doesn't count some of the grants that we just didn't attempt due to lack of resources and time to write them. Many of these grants would have been successfully landed if we had focused and dedicated resources working on grant development. So this position would ensure that we identify the best grant opportunities consistent with our strategic plan and our role in the city, help program staff make sure our applications are compelling and responsive to grant guidance. I included the role of public health planner because in this world it really is communities that compete for grants, and it's important that our project planning incorporates not only the best practices and models, but also the right community partners and collaborations. So that will be a big part of this position as well. We expect the position to increase our grant win rate and help us garner more resources to better accomplish our mission. The third improvement is an IT resource, a business analyst. And this is, there's a lot of transition going on in the world of IT. We provide a lot of direct service, a lot of direct clinically oriented service. And we're reliant on the state's system, which we call PTBMIS. I won't tell you what it stands for. Patient, never mind. It's an old system, and we have 200 users, about 200,000 encounters tracked on that system. The state, and we have 1 person able to support it, barely, for those 200 users. Now the state is beginning work on a new system. It will take them several years to complete that, and during the transition time we'll really be operating with 2 different systems, and we believe we're going to need an additional resource just to cover the support needs for that transitional time. The final improvement in our submission that we hope you'll consider is for a community liaison to help support our efforts in healthy eating and active living. And this is really to help sustain the Nash Vitality movement. If the brand sticks and keeps going, either way, the epidemic of diabetes and other chronic disease that go with obesity is one of the great challenges of our time, as you know. CPVW and your efforts have added great momentum to our efforts, but this really is kind of a community-wide project that will take many organizations many years to complete. We have some staff working on several key initiatives for CPPW continuity, but we have come up a little bit short on the idea of a designated resource to manage and facilitate communication among the many community stakeholders who are moving Nashville in a healthy direction. So this position will be an energetic networker. They will manage the Nash Vitality content on the website, related social media, highlight and facilitate efforts across the community to make healthy living easier, whether they're in Metro or outside of Metro, and a wide variety of organizations that are really excited about this. With your help, Mayor Dean, this movement has really gotten Nashville on the map as a community that's making healthy changes. We think we'll be more likely to stay on the map, and more importantly, to succeed long-term if we have a dedicated resource to help sustain our momentum. Finally, with regard to the capital budget, we're making some requests for equipment necessary for the new public health headquarters. We're also requesting support to begin planning for a replacement for the Woodbine Clinic. This is a very old building, originally an elementary school. We've repaired holes in the floors, walls, and roof. and we feel like we need to be looking ahead and trying to locate a suitable location that's acceptable to the community and convenient to our customers. Again, we appreciate your support for healthy living. Hope you'll support our budget, and happy to take any questions that you may have.
Well, first let me commend you all for the work you did on the meningitis outbreak investigation. I mean, it was obviously something you didn't expect, and Nashville suddenly was sort of at the center of a lot of that, so I really appreciate the hard work and how well the city was represented. Let's talk a little bit about animal control. Your request is to add 3 employees to animal control. Mm-hmm. And what functions would they perform?
These would be field officers. 2 of them would be regular field officers. They'd be out there in the community responding to complaints, picking up dogs. Some of the additional things that are now going to be possible with changes in state law is chemical capture. We'll have more capability to respond quicker and respond better.
And what's chemical capture for?
Well, it's basically where you shoot a drug at the dog to basically tranquilize it, so that you don't have, that you can capture it. Up until now, state law required a veterinarian to be on the truck to do that, but we'll have additional abilities to do that kind of thing moving forward. So there are 3 field officers. One of them is a field supervisor, but the idea is really to have those forces deployed in the field, and it's really to get us back up to the 31 officers, which is where we were in 2007.
Has the number of complaints or information called in about stray dogs, how's that tracking? Is it going up, or is it stable? Or
year on year, I'm encouraged and I'm optimistic. We've had slight reductions year on year in total requests for service, animals running at large, and we've even had year on year reductions in euthanasias required. But they've not been dramatic.
Okay. The issue of euthanasia, which has received some attention recently, what is the health department's policy, and what can you tell us about where we are with that?
Well, our main function is a public safety function in terms of preventing animal bites, allowing people to play and walk and enjoy their neighborhoods without being afraid of the animals running at large. So that's our biggest mission. And we end up bringing in more animals, and we bring them in that way, but we also have people deliver them to our doorstep.
People who are giving them up? Or?
Yeah, people giving up animals all the time, and the simple fact is there are more animals than there are homes for them. We believe we do adoption. We have partners that we work with for adoption, and I think we want to maximize that, but we think there are limits to our ability to adopt our way out of the excess of animals, or the lack of homes for all the animals. So we've been very focused on trying to make spay and neuter services accessible and affordable, especially in the neighborhoods that have the biggest problem with excess animals. So basically, based on space or based on injury and illness, there are animals that we do need to euthanize each year.
Well, is there anything that, in terms of adoptions or reducing the number of animals that have to be euthanized, is there anything that you have identified that you or the health department can do to result in more animals being adopted? Or is there a resource issue or an approach issue? Or
I think with more resources, we could always do more adoption. I mean, I think the biggest, if I was given a resource opportunity to try and intervene on this problem, where I would spend my money is to try and make spay and neuter more widely used and more widely accessible. And we did some of this. We continue to do it basically in partnership with Nashville Humane. They've got a little truck, Rover,
Nice.
go out to the high-risk communities. We have conversations with veterinarians. We use a means test. But the idea of getting as many spays and neuters done in these high-risk neighborhoods as possible, I think, is probably the best way to invest. Now, we can do a better job of PR about adoption. We're going to work on that. We can have more partners involved in adoption. We've developed some of those, and we can develop those further. I don't think we want to leave any of those by the wayside.
And if you increase the spay and neutering program, describe what you have in mind, or?
Different places do it differently. There are some people who want to take a regulatory approach. My personal view is that's kind of up to elected officials to talk through. I know there's some communities that have expanded access using a voucher program. They raise money and they put it out there for veterinarians to provide these so the veterinarians are out there. You get kind of using a voucher program. The people who have the greatest need, the animals that get the greatest need, are referred into those, and that's supported in that way. We're just beginning to investigate voucher type program and what that would mean for Nashville.
Okay. You've the program, the fatherhood program, that has gone well.
Yes, obviously
describe what it is. I guess.
It's a new program. It's a lot of it has to do with curriculum, teaching dads who they didn't have a dad growing up. Such a high percent of our families in Nashville are single parent households, and the fathers are often not a part of the picture for the kids growing up. And so we've been supporting this idea of really kind of building curriculum, helping dads get the tools and the basic skills needed to be engaged in both the raising of their kids, but also the supporting of their kids. And we've been encouraged. It's not easy going. The numbers are not huge of graduates, but we are continuing to graduate classes of dads. Also connecting with the criminal justice system so that there's some ties in with re-entry from the correctional system. So we think, and there's a lot of interest in this program in the community, and we're excited to see it grow and see it mature.
The liaison you're requesting for the healthy eating campaign, this person would maintain the web presence of Nash Vitality.
Yeah, I mean, we've created a nashvitality.org website that has a lot of kind of community resources and a community forum type of thing. Our plan with the mayor's office is to bring that functionality into nashville.gov, but it will still need somebody who's paying attention to everything that's going on in town and making sure that information is collected. I don't think it starts and ends with the website or even with social media, though. I think it's really being out there communicating and knowing what's going on in town, making sure that the different entities are talking to each other about both accomplishments and opportunities to do better.
Right, because there are a variety of nonprofits and other interest groups who are up, whether it's locally grown food, organic food, or encouraging people to eat healthier.
And there's so much great stuff going on in Nashville. And it's very exciting. And I think that there is a benefit from sort of feeling like it is the community's momentum, even above and beyond just all these individual great efforts that are going on.
Okay. And then I think this year or in the very near future, the auto emissions contract expires?
That's correct. The date is 2015.
2015?
Yeah, we're basically trying to get the RFP ready and on the street. I mean, one scenario, if something major is going to change with the vendor, they need a lot of time to get in place for that start date. So we wanted to, we don't have any prediction about that. We just wanted to make sure that there was enough time in the process so that if there's new stations that needed to be built or what have you, that there is some time in that time.
So it's 2015, and you're just getting an early start, given the complexities of any change. Okay. And could you, on Lentz, the new health center, what's the completion date estimation, and how are things looking?
Stan is in contact with the project managers at HCA.
June 2014.
June 2014. Good. Everything looks like it's going the way you want it to.
We're excited about it. We're very excited. It looks like a construction site right now.
Yeah.
But we worked very hard with the design team, and we're really pleased with how things are going with the construction team and with HCA. Put a lot of thought with the architects into how to make this a healthy place, healthy space, healthy work site, and we're excited about that.
Good. Rich?
Just on the, on the animal control people, I think everybody sees the need for some additional people in the field, but you mentioned that 2 of them will be field officers, and the third one's the supervisor. Will they be in the field, or what's the supervisory, what's their role in the function?
I mean, my idea is that person will be field-based, but
okay. Because I think it's important to have as many people in the field, so it's...
Yeah, no, I will insist that be a resource in the field. The organization out there has run very flat, and so I think there is a need for management and sort of sharpening the skills of the workforce and all that. There's a need to have sufficient supervisors, but they're not going to be hands-off.
On that same subject, you mentioned raising the license fee to generate revenue to offset that cost. Is that in place or to be done later, or what are you thinking on that?
It's basically, my understanding is it's being introduced to track with the budget.
Okay.
So the language.
It's a council ordinance.
Yeah.
It'll take council action, and it would be filed. I think the discussions have been, Greg, would they file that when we file the budget?
Okay. And would the fees generated pay for the positions?
Yes, we anticipate they would.
It would cost about $150,000 for this improvement, the 3 positions, and we anticipate the revenue would generate about right at the same amount of number, give or take a little bit.
Yeah, last year was a slight dip in registrations, and that's what we based on. We based the projection on. The previous 3 years, it would have been more, $170,000, $180,000.
And my information is that at the increased rate of $6, we're still lower than Charlotte, Louisville, Austin, Chattanooga, Memphis.
It's still reasonable if you're comparing us to other cities, right?
Okay. Well, I guess I should give a pitch for animal adoption. We adopted one, and it's worked out pretty good.
Yeah, we did too.
He does his best.
We did too. I mean, I think it's there's so many things we pay attention to. That is one where that's really it's a safety issue. It's also a quality of life issue. And
well, it's a tricky when people abandon an animal. I mean, to say and it may be it's the appropriate thing to do. You don't leave it on the street, and they bring an animal to the animal shelter, or somebody just makes an affirmative act and abandon an animal. Is there no cost to them when they do that?
We've been back and forth on that. We don't want the alternative to be, driving them to some other county or driving them to a lake or what have you. So the staff have really been not keen on putting a disincentive to.
No, I'm not necessarily advocating. It's just sort of it's a difficult issue because you have, we spend, I don't know how much we spend on animal control in a given year.
We've got that for you. About $1.8 million a year.
About $1.8 million, and you have, a key part of the issue is responsible pet ownership.
Absolutely.
You have the public safety issue, which is your responsibility to make sure people aren't being bitten or bothered by animals. You then have almost the humanitarian sense that we don't want to be a city with the highest euthanizing level of any major city, and you want to do everything possible humanely. And coming from a family of dog lovers and people who might go home, this will be an issue people will talk to me about. You don't want to, again, that's something I think we need to do better on. But it's almost like it's an expense that is, you want to get on, you want to somehow control what's being generated, because it seems like an endless thing. If the city is, and then there's not a limitless number of people adopting dogs. I mean,
Right.
If people are turning dogs into you, there aren't people there necessarily making up that on the demand side.
Right. So, I mean, it's the story of public health. How do we go upstream? How do we turn off the faucet or keep the babies from falling in the stream in the first place, rather than saving them once they've come down? And so, yeah, we have to work. It doesn't start and end with us, but we play a very important role. We need to work with community partners, volunteers, what have you, and get the word out. But really, spay, neuter, making sure that the default, the normal thing for pet owners is to have an animal that's been fixed, because that that reduces the pressure on.
But even that
animals.
requires, I mean, when you get a dog, when you adopt a dog from animal control, when we did, the animal has to be neutered before you.
They do, yes.
Get the animal. In terms of, well, as we know, there were newspaper stories written about this. Are there other cities that can be seen as a role model or something they've done that we could adopt that would result in fewer animals?
Yes, I think there are. There's a variety of different strategies that cities have undertaken, I guess some cities really put more resources into that whole enterprise of more resources into adoption, more resources into spay neuter. Some communities have actually put kind of an incentive on spay neuter through a differential licensing program. That's been looked at here. It's not been.
It's never been without controversy.
It's never been without controversy, and if you ask me to guarantee that something like that would work in Nashville, I couldn't guarantee it for you. But certainly, it's something that people think about.
Yeah, it just seems you can't keep doing things. I mean, and not the health department, not being critical of the health department, but you can't, as a city, just keep doing things the same way as we produce more and more abandoned animals or animals left running wild, and then expect the result to be different when you go to animal control. And at the same time, if there's some amount or some creative way, and there's plenty of nonprofits that are very interested in saving animals, that you could work together to create a better result, that'd be another way to approach it.
Yeah, I think some of the things we have done, we've made a lot of effort to try and just get the different people who care about animals in the same room talking to each other and doing some coordinated planning. And again, I think some of the ideas that seem to be pretty interesting and that we may be able to get some traction on, one would be to try and expand a voucher program for spay and neuter. Others will be to increase adoption through a variety of promotional efforts.
Well, I would think that this would be a good time to sort of ramp up the public relations aspect on adoptions, at the same time looking at spay neutering more aggressively and look at incentives and different ways of doing it. It would seem to me that the issue has been pretty crystallized, at least for the public and for me, and this is an opportunity we should take advantage of.
Okay.
And then I'll report to my wife and daughters, and I'll have more questions for you as we go forward. Rich, anything further?
No, I think I don't know if this is true or not, so I'm not saying being critical, but I think we just need to make sure we reach out to the community and those lovers that care about the adoption, and make sure that they perceive the health department as being their partner in that process. And I'm not saying you don't do that now, but I think that's the perception, perhaps, is that we're not doing as good enough job as we should be doing on that. And it's much more difficult than just what I just said.
Well, that's part of how we do business, is to really engage folks who care about what we do. And we're glad to have people who care about what we do. So,
Right. Nothing else.
All right, thank you. Appreciate all your hard work. You've been a great partner on healthy living, great leader on that, and again, thanks for your work in the emergency. That was above and beyond. So thanks.
Thank you.